All right, so I have David as a client today, and what I'm looking for, I'm always do the postural assessment when customer lay down and how they look like erector muscles, erector spinae muscle. And what I'm looking for here, I'm looking for that right side is kind of like a little bit more pops up here. And what I'm looking for on this lumbar area, this side is deeper in that side. Let me see if you guys can see on my camera. Yeah, it's really hard to see, but this side is dropped down and this side is pops up. So what I'm doing here, I'm always do my twister, and this is what I do. I found that ilium bone, lift it up just like that, and lock with the other arm on the SI joint. Now I take him to the first barrier. And I feel a restriction now. I ask to David nicely, push it down, push down, and let it go. And I take to the next barrier and twist a little bit more. Is any pain?
No.
Always ask about pain. So go ahead, push it down now, and let it go. And I take to the next barrier. Okay, I'm letting go, and as you can see, I see the big difference already. I change it here, it starts changing in thoracic area too. But as we know, this rib is pop this way. What we want to do, we want to bring this down, okay? You can always measure, just take your big thumb and just go all about laminum groove and find out which level, like which finger is higher. And exactly, you can find exactly where is the twist is started. You see, my fingers is like it's the same, and it's bomb right in here. This one is come deeper, the right one, and I mean the left one, and right one, it's come more up. All right. So usually I ask clients to come down a little bit and start breathe. I'm gently kind of resisted that rib cage, and he breathed against me. This is all I ask him to do. And I ask him to activate your abdominal muscles. Yes, push with your stomach slowly. Really good. So I'm following his breath. Good. Now I can work on that spinae muscle, erector spinae. And I come to the side, I follow that laminum groove. I put too much oil, which is not supposed to do that, but yeah. So what I'm doing, I'm just slowly, and David breathe in and breathe out. I'm just move medial to lateral. Is any pain, David?
No.
Pressure is okay?
Yeah.
Good. There we go, slowly and nicely. And it's a lot of muscle can be affected, not just the spinae, it can be pec muscle, pushing your, pulling your shoulder forward. Okay, and now I'm always working the laminum groove. I'm always go from the head down. So this is my direction. I use 2 thumbs or 1 thumb. And I'm slowly move to laminum groove and just find out if any vertebra push me away from my path. And what I'm doing here, I found this right in here. How's it feel, David? Is that sore pain?
No, that's good.
Good. So I'm feeling it right in here. And I ask him to start breathe deep and slow. So this is my speed. I'm never rush myself. My shoulder, I'm relaxed. My shoulder is down. And this is my speed. Do you feel that spot right in here?
It doesn't hurt. It feels good.
Every time you feel something like not right, if something pushing you, just make sure you spend a little bit extra time and it's non-painful area. You always communicate with your customer. This is the tip to be successful manual and massage therapist, to communicate with your customers all the time. Even if you have an English problem or language barrier, you always ask if any pain. Now I'm going to work a little bit on the left side too. Just make sure it's open. Yeah, it's really nice and smooth. So basically what I'm thinking, the one side is not breathing right and this shoulder is always back. Okay, so he's kind of like rounded more here. Okay. Here I can work a little bit on serratus muscles, make sure they're active. Probably the best idea to work on that serratus because this serratus is probably weak. Ooh, I catch the camera. Jeez.
What?
Oh, it's almost falling.
Oh my god.
That's okay. So yeah.
Wow, that side is different.
So what I'm doing here, I'm lock the lower partial of the body. I'm not pushing on the spine. I'm just kind of hold. And what I'm doing here, I try to lift that side up. So I grab those serratus muscles, serratus posterior, anterior, and pull them up. Okay. So this is the action. So I kind of like grab the fascia and pull. And I can use both hands or one hand, and I do this. And I'm doing that. How's it feel?
Very good.
Okay. Yeah. This is how you work on this thoracic muscles. Make sure he's breathing. Now I work both sides. It's nice and smooth now. You can see how deep I can go. I'm going a little bit quick because the time and for the video, but I'm going really, usually in real life it goes slow. And ask the clients to breathe all the time, in and out, in and out. You want to feel that muscle is activated. All right. And as we remember that shoulder have some mobility problem, what we're going to do, we're just gonna, for the camera, I'm not sure, so let me check the camera. Yes. Not gonna be comfortable. So what I'm doing here, let's just work on the left shoulder. Okay. What I'm doing here, I'm asking David to bring the arm on the side. I want to reactivate all the muscle between your shoulder blades and try to pull that scapula back to the midline, because as you can see, the scapula is a little bit slide off because the pecs is probably dominated, and they pull that shoulder down. So what I'm doing here, I'm gonna grab that shoulder, place David's hands right in the back, grab that scapula. You see the scapula comes up right away, like right in here. You can feel that angle of the scapula here. Now I'm redirect my left arm, and what I'm doing just gently kind of like twisting this way. So I try to pull the scapula towards the spine. This is what I'm doing here. There we go. Gently. And ask David, sometimes resist me. Go ahead, push down, David, and let it go.
It's just inhibited, right?
Yep. So how's it feel?
It feels good.
Great. Now, we always can use the band, resistant bands. When I'm here, I'm bring the David to this uh, position, and I want him to reach this in the front, yes. And what I'm doing, and go back, like a Superman. You feel like crunching?
Yeah.
So what I'm doing here, I'm always reactivate this muscles. How's it feel, David?
Oh, good. Very good.
Yeah, very good, you see. So I pull him all together. I want him to do action. And when he doing action, I want to feel, he wants to feel this muscle, not me. I'm working on his shoulder, and the idea is to make sure he feel all those muscles functioning well. And what you gonna see, what you gonna feel, something not work, something weak, or something like restricted. Okay, so I can hold that shoulder and I can do it again, and I move it around. And as you can see, his arms will always go down. I ask him to go a little bit forward right here. Whatever it's not cause you the pain, make sure there's no pain in the shoulder too. Bring it back. You feel that clinking?
When I bring it back, it clicks.
Yes, I know. So we have to really restore that. And look at this lats too. Go ahead. So what I'm doing here, I grab that lats and pull towards me when he's doing that. I want to make sure he feel that lat too. Do you feel that lat? Good. So I want to make sure he feel every single muscles. Okay. Next, you can do not just the forward. You can do abduction and adduction. So basically, you just do a rotation of your shoulder, just like that. How's it feel?
It feels great.
Good.
Yeah, they're weak.
Okay. And I'm gonna take this camera a little bit further. Make sure you guys see what I'm doing here. Now, I place my hands on the top of the shoulder, grab the whole humeral bone, and I'm just doing that. I'm rotating the humeral bone and scapula together. Now I can just do humeral bone, and you can see its movements. Great. Let's do it together, David. I want you to start rotate your arm like this. And I come up from both sides, and what I'm doing here, I help him out. How's it feel?
Oh, it feels great.
And go opposite way. Always do both ways. Let it go. Good. Next one, we want to activate muscle like a rhomboids muscle, lower trapezius. I want him to squeeze your arm like a squeeze. Here we go. You see he's reactivate, and what I'm doing here, I push it together. You don't need to push hard, David, just a light. And I help him to reactivate all these muscles. So what he's doing, he's going to pull the scapula together, and I help him out. You can see all these muscles is get active, and I put them together. This is how you do manual therapy for the thoracic area, and it's a lot of techniques, but make sure you help your client to understand which muscle is weaker and which muscle is tighter and which one is limited your motion. Okay, and of course you're going to do face up and work on the pectoralis muscles. All right.